CHARGE syndrome is a recognizable genetic syndrome with known pattern of features. The letters in CHARGE stand for coloboma of the eye, heart defects, atresia of the choanae, retardation of growth and development, and ear abnormalities and deafness. Although these features are no longer used in the diagnosis of CHARGE syndrome, the name stays the same. Coloboma of the eye is an abnormality in the eye, usually a missing piece or a misshapen pupil. Heart defects involving the walls, veins, arteries, and valves of the heart are common. Atresia of the choanae is a genetical disorder where the back of the nasal passage is blocked. Most children have hearing loss, vision loss, and balance problems that delay their development and communication. Babies with CHARGE syndrome are often born with life-threatening birth defects. 1 in 1,000 births will result in CHARGE syndrome. Most families have a 1 in 10,000 risk for another child with CHARGE. A few have other sperm or eggs that carry the CHD7 variant and a 50-50 risk. Because it is not currently possible to distinguish between these groups, the best we can do is look and fear them. Based on the experience of thousands of families, the reoccurrence risk is 1 to 2% on average. Most CHARGE syndromes are caused by a mutation on the CHD7 gene. Not every child will have a mutation on this gene. All children will have at least 2 of the major disorders that make up CHARGE's name. The typical child with CHARGE syndrome is followed by an average of 17 different medical specialists and will have more than a dozen surgical procedures before he or she is 10 years old. There really is no specific treatment for CHARGE syndrome because it is a combination of disorders. Children with CHARGE syndrome will have a hearing impairment, some sort of visual impairment, a developmental delay, and late referral to appropriate education resources. Most children will be labeled deaf-blind, and there is a lack of information on how to teach these children. Some individuals will need extensive care throughout their lives. Some become independent adults with families and professions. Most are somewhere in between, taking longer to achieve things and needing at least some degree of support throughout their lives.